Hello, welcome to the fourth module of the ICRC online training on sex work, HIV and human rights. In this presentation, we will look a bit deeper into sex workers' involvement in HIV response across the world and in the European region. In the course of this module, we will try to provide you with a brief overview of the history of sex worker community engagement in HIV-related interventions, and will try to show you why sex workers' direct involvement, participation, and leadership in response to the HIV epidemic is critical to end AIDS. Let's for a moment get back to the right to health we discussed before. As you remember, we stressed that the right to health is a complex and multidimensional right, which includes a wide range of factors that can help us to lead a healthy life. In this presentation, we would like to focus in particular on one aspect of the right to health, to which we referred as participation. This specific element of the right to health means that informed and active involvement of communities in health-related decision-making processes and public health response at the local, national, and international level is a key precondition for the enjoyment of the highest attainable standards of health. This means that sex workers, just like all the other populations, should be treated as strategic partners in decision-making activities and programs that deal with health problems relevant to them. Moreover, the states should provide a safe and supportive environment for sex workers that ensures that opportunities for such a meaningful participation are met. As we have mentioned in one of the previous presentations, the one on the right to health, despite many barriers and hostility, the sex worker community has been actively mobilizing to counter the adverse effects of HIV epidemics since its very beginning. Some even say that the outbreak of HIV infection has been one of the key factors which triggered the development of sex worker movement globally. We would like to argue, however, that sex workers' mobilization started long before the beginning of HIV era, and sex workers' involvement in HIV response was in fact a logical continuation of community involvement in the struggles for sex workers' rights prior to the outbreak of HIV epidemic. Probably all of us have heard that one of the very first sex worker organizations was the Coyote, Call Off Your Old Tire Addicts, formed in the US already in 1973. The sex worker collective was established by famous sex workers' rights activist and sex worker herself, Margot St. James, who mobilized community members around demands for freedom of sexual expression, right to autonomy and self-determination, and ends to discrimination and social marginalization of sex workers. The beginning of sex worker mobilization in the European region, alike in the US, is usually traced back to the 1970s. Indeed, on the 7th of June 1975 took place one of the most recognized and cited sex workers' collective actions in Europe. Hundreds of community members occupied the Church of Saint-Nizier in the French city of Lyon to protest against police harassment and disrespectful treatment. Mobilized around their leader, Ulla, whom you can see at the picture, Lyon sex workers remained in the Church of Saint-Nizier for more than a week, demanding social justice and protection, as well as an end to police repression, including repeated fines, abuse, and increased incarceration. Throughout the strike, they not only managed to bring media attention to their grievances and demands, but also gained support and recognition from various organizations, including trade unions, feminists, and some fractions within the Catholic Church. Saint-Nizier occupation in Lyon contributed to sex workers' mobilization in other French cities, where similar church takeovers and protests took place in the following days. The protest in Saint-Nizier has been followed and in some cases directly triggered the development of numerous national sex worker-led organizations and collectives throughout Europe. It immediately inspired the creation of English Collective of Prostitutes, ECP, in England. Subsequently, Hydra in Germany was formed in 1980s, followed by Aspasi in Switzerland in 1982 and the Italian Committee for Civil Rights of Prostitutes. All these organizations exist and advocate for sex workers' rights until today. At the same time, sex workers decided to expand their mobilization from the national and to transnational arena by forming international sex worker collectives, such as the International Committee for Prostitutes' Rights, ICPR. It was created in 1985 during the First World Whore Congress held in Amsterdam, which brought together numerous sex workers and sex workers' rights activists from across the globe. During the First World Whore Congress, the International Committee for Prostitutes' Rights adopted the famous World Charter for Prostitutes' Rights, bringing together such demands as decriminalization of sex work, protection of sex workers' labor and human rights, as well as the right to health, and appreciation of sex workers' right to organize. On the online platform, you can find a very interesting report about these events written by Gail Peterson and Margot St. James, which also contains the declaration. What is also important from our perspective is that during the Second World Whore Congress, which took place in Brussels a year later in 1986, participants directly addressed the issue of HIV epidemic among sex workers, objecting to scapegoating of sex workers as vectors of disease, and calling for sex workers' collective mobilization to prevent the spread of HIV among members of their community. In the meantime, sex workers around the world mobilized to provide fellow sex workers in their local communities and countries with condoms and HIV prevention education. One of the very first sex worker-led HIV prevention projects, called PEP, so California Prostitutes Education Project, was created already in 1984. It was followed by the development of the Empower in Thailand in 1986, as well as the development of Scarlet Alliance in Australia, Australian Sex Worker Association, in 1989. Another organization which was created at that time was ScotPEP, Scottish Prostitutes Education Project, which dates back to 1989. Its creation was followed by the creation of Davida, famous Brazilian sex worker-led organization, which was launched in 1992. Another sex worker-led organization providing services for community members was Cabiria, developed in France in 1995. Also, in South Africa, Sex Workers Education and Advocacy Task Force was created already in 1996. These are only a few of the many sex worker-led organizations developed in the 80s and 90s to provide community members with HIV prevention education and safe sex equipment. Community-led service provision initiatives on the local or national level were also accompanied by the international sex worker mobilization in response to HIV epidemic. From the very beginning of the HIV epidemic, sex workers have been following the developments in HIV interventions and taking an active part in international meetings of communities affected by HIV. For example, during one of such conferences, Second International Conference for NGOs Working on AIDS that took place in Paris, France in 1990, numerous sex worker collectives and initiatives undertook a decision to launch a global network of sex work projects, international alliance of community organizations engaged in the HIV response that exists till now. Similarly, International AIDS Conference in Yokohama, Japan, that took place in 1994 hosted International Sex Worker Meeting, which contributed to the development of Asia-Pacific Sex Workers Network. Sex workers' involvement in the fight against HIV has become widely recognized, and already in 1998, NSWP has been invited to become a partner organization of the International AIDS Conference in Geneva, Switzerland. Sex worker engagement in HIV response was not limited, of course, to participation in international AIDS conferences. International sex worker community and local collectives have been involved in many HIV-related campaigns, as those around mandatory condom use, so-called 100% condom use programs introduced in Asia. Many community-led organizations, including St. James Infirmary in the US, have been protesting against criminalization of condoms that put sex workers at risk of HIV infection, or demanding access to high-quality antiretroviral treatment. As sex workers from Asia Pacific Sex Workers Network, you can see the photo in front of you. Many of sex workers' demands and advocacy has been centered around community involvement in HIV response and participation in the decision-making on issues around HIV programming for vulnerable communities. For example, in 2010, sex workers along people who use drugs have organized a protest action during the 19th International AIDS Conference that took place in Washington. Due to US governmental travel restriction against sex workers and people who use drugs, namely restrictions that prohibit entry to the US for the people who have been engaged in sex work for the last 10 years and people who have convictions related to the drug use respectively, many members of the key communities were not able to take part in the conference. Those who managed to attend staged protest during one of the conference sessions. Let's see what they've done.
Next speaker is Professor Diane Havler. She is chief of the HIV/AIDS division. And
what about sex workers and drug users that are not here? Nothing about us without us. Nothing about us without us. Nothing about us without us.
The message they've sent was nothing about us without us, what means exactly that no decisions concerning HIV response among sex workers should not be made without sex workers' involvement. In fact, sex workers went even farther in expressing their discontent with exclusion of sex worker community from the International AIDS Conference, as they organized Sex Worker Freedom Festival in Kolkata, India, often described as alternative international AIDS conference. It was attended by around 700 sex workers from over 40 countries of the world. Let's watch a short video about this amazing event.
Welcome back. Sex workers from 42 countries took to streets of Kolkata protesting the fact that they weren't allowed to attend the 19th International AIDS Conference in Washington, D.C. That's on now. The world's largest AIDS meet was possible because the U.S. in 2009 lifted a ban on entry of HIV-positive people. But those who sold sex or used drugs aren't allowed entry by America. So sex workers from Uganda, New Zealand, Hungary, Russia and a host of other countries arrived in Kolkata for an alternative, a satellite event called the Freedom Festival.
Sex work is work. Sex work is work.
They are the one group of people most vulnerable to AIDS. They are also held responsible for the spread of the disease. And yet, they have not been allowed to attend the world's largest AIDS conference in Washington. So some 800 sex workers from 42 countries have gathered in Kolkata to ask why this discrimination.
No,
It does not make sense to have an AIDS conference without sex workers. The organizers of the conference need to be smarter when they think about where to have what policies are in the country they're having it in.
ये तो HIV कॉन्फ्रेंस में वाशिंगटन जाने नहीं दिया, ये बहुत निंदनीय की बात है, बहुत क्या बोलेगा, बहुत बुरी बात है. हम लोग इसके विरुद्ध में लड़ाई करेगा और इसका विरुद्ध में आज स्लोगन उठाएंगे कि HIV कॉन्फ्रेंस इंटरनेशनल कॉन्फ्रेंस से सेक्स वर्कर क्यों जाने नहीं दिया.
I think it's sending a very, very strong message to the AIDS conference organizers that you cannot turn the tide without us. You need us. We are part of your solution and we have the right to be with you.
Sex workers' rights are human rights.
Kolkata is playing host not for nothing. It is the seat of one of the most successful experiments in the world for the empowerment of sex workers. The 20-year-old Durbar Mohila Samonnoy Committee, which collectivized sex workers who demanded ration cards and education for their children. India's support for such networks of sex workers is unique.
The voice from Kolkata is loud and clear. Sex workers want to be and are part of the solution to the AIDS problem. The problem is the United States listening? In Kolkata with G.D. Shankar, Monideepa Banerjee, NDTV.
So our guest this evening, some of the participants of that conference, Meena Seshu, she's the General Secretary of Sangram, she's an activist in this area, and Pickering, who is a member of the New Zealand Prostitute Network, and in studio with me, Anand Grover. He's a senior advocate and he's also director of the Lawyers Collective, which has worked in this area. Meena Seshu, if I can start with you, why did the organizers organize this conference there where sex workers aren't allowed?
You know, that's the big fight, because the US has thwarted this attempt. It's 25 years of AIDS conferences where scientists, activists speak together about how to fight the epidemic, but the US this time has thwarted this attempt. We were expecting till the last minute that the US will remove this travel restriction against sex workers and drug users, but they did not. And because of which, even if sex work is legal in your own country, the minute you enter the US, you become illegal. So it was very dangerous for sex workers to go to the conference in Washington, D.C.
Through all initiatives and projects described in this presentation, sex worker community globally manifested conviction and proved that HIV epidemic among sex workers cannot be dealt with and properly addressed without sex workers, because sex workers are the solution, not the problem. In fact, during the recent years, researchers started measuring effectiveness of community-led response to HIV. They actually came to amazing conclusions, proving that community-led HIV prevention interventions among sex workers are associated with significant reduction in HIV and STI outcomes and could avert the HIV epidemic among sex workers. It has been proved that community-led interventions could lead to 32% reduction of the odds of HIV infection among sex workers reached by community-led HIV programming. Also, it could lead to 39% reduction of the odds of gonorrhea, circa 25% reduction of the odds of chlamydia, almost 50% reduction in the odds of syphilis, and threefold increase in consistent condom use with clients among sex workers reached by community-led programming. Community engagement was also recognized in the documents developed by WHO and UNAIDS, especially the so-called SWEET tool, implementing comprehensive HIV/STI programs with sex workers, practical approaches from collaborative interventions. In this document, the term Community Empowerment Approach to HIV Prevention among Sex Workers was introduced. We will explain in more detail what this community-based approach means and what are its key elements in the following presentation. And we will end this video here while inviting you to take a look at the training materials available on our online platform and inviting you to engage in conversations on discussion forums created especially for you. Thank you.